All right, welcome to everyone. I know we got started just a minute late and I apologize for that, but we are here, we are ready to go this evening. Welcome to our first webinar of Spring Health Professions Week, and I'm actually really excited to welcome my friend. She's a friend of HPW's, Ms. Joanne Snapp. She's known to some of you on Instagram and Twitter as my honest advisor. Joanne has an amazing background. She has worked in both graduate medical admissions, so she's been on the other side of the aisle. She has most recently worked in undergraduate pre-health advising and post-bac programs, getting students ready to apply. She has a wealth of knowledge when it comes to helping students identify where they fit in the big healthcare world. And so finding your fit in healthcare tonight, I am so excited to welcome you, Joanne. Thank you for being here.
Thank you so much. I'm really excited to be here. I'm excited to be talking about this. And if anybody who is here happens to have any questions throughout my talk, please feel free to post them in the chat. Mandy can ask them on your behalf. And if we're ready, Mandy, I'm going to jump in and get started.
Let's do it, Joanne. The floor is yours.
Okay, great. So Mandy asked me to come and talk about helping people explore careers in health. And it's so funny that I was asked to speak on this because I'm actually not I'm not a health professional myself. And if you would have asked me, 20 years ago, if I would ever be talking about this topic, I would have told you absolutely not. I was going to be a high school English teacher of all things. And so why that's relevant to this idea of finding your fit in healthcare is that sometimes the way that we find our way to a particular career is not necessarily linear. When I started my career thinking I was going to be a high school English teacher, I moved to New York City and was looking for jobs, couldn't find a job in teaching. So my first job was actually in admissions at a podiatric medical school, which is ironic because I couldn't even say the word podiatric medicine when I interviewed. I had no idea what podiatric medicine was. I presented well. So they were like, yeah, we can have you represent the field. I ended up shadowing physicians. I sat in on classes. I traveled around the country speaking about this profession, learned anything and everything. I once gave a presentation in Texas about podiatric medicine, and I didn't know there was a podiatrist in the audience, and they came up afterwards and said, I would have never known you were not a podiatrist the way you talked about the profession. So that's how much I learned about the field. And then from there, I went over to a nursing college in New York, and I spent 2 years helping people navigate mostly nursing careers, but I also helped a lot of people who wanted to go into fields like speech language pathology and music therapy and some other sort of outside of the box health professions. And then like Mandy said, I then went to allopathic medical school, where you would think, okay, I was only doing medicine. But in doing that, I also learned a lot about the PA school on campus. I learned a lot about public health. And because they're all related, whenever you work in a health career, you're never going to just be in an isolated bubble with just physicians. I worked with MDs and DOs, I worked with nurses, we had PAs, we had, all the health professionals working on our team at the medical schools. And so all of this information, I then took over to the other side, the undergraduate side, where my knowledge exploded. Working with pre-health students for 6 years, there's no way you're not going to learn a ton about different health professions. And I've been very fortunate to get to travel to lots of different health profession schools at conferences. The coolest one I think I went to recently was a nurse anesthesiologist or nurse anesthetist. So cool. I had no idea that was even a thing. And so there are just so many careers out there. And so you're all here tonight because you want to be a health professional. And maybe some of you know exactly what you want to do, and you're here just to learn maybe about other things. But maybe you want to be a health professional and you have no idea what that looks like right now. You just know, usually people want to go into health professions because they know they like to help people and they usually like science. And so those two things together are a great combination for people who want to go into the health professions. Tonight, I hope by the time we're done that you can name on your hand at least 5 professions that maybe you've never heard of before that you might write down and consider looking into. And I'm going to talk to you at the end about what does looking into mean and some ideas for how you can go about exploring. I like to start when we think about how someone chooses a career, thinking about what it is that they want to do. And so your why anything, whatever it ends up being, whether it ends up being why dentistry or why physical therapy, it usually is based not on a journey story of how you got to that decision, but our why is usually based on what we want to do in the future. So if I said, why do you want to do this job? It's probably because you see some problem in the future that you would like to address, some problem you'd like to solve. And maybe you see yourself doing a certain thing with a certain community or population of people. But our why is almost usually entirely based on our future. I think a lot of people like to think about our why being what led us to that decision. And you're not quite at that, right? You haven't made a decision yet in terms of what you want to do. So for right now, as you're exploring, I want you to try to think about, what does your future look like? Have you ever sat and thought, where do I see myself going to work every day? When I get up and I get dressed, do I see myself driving to a big hospital? Do I see myself driving to a practice? Do I see myself walking in the door of a small clinic and being greeted by my staff that I work intimately with? Do I see myself being on the, out in the field, like on the ground, out in the community doing things? Whatever that looks like for you, that's how I want you to start to shape your why. So I want to be an X, whatever X ends up being for you, because I want to do X, Y, or Z in my future. And so that's where I want you to start thinking about what your future might look like, is by thinking about what it is that you want to do. These are all the professions that we are going to touch upon today. I only have a short time with you, so I'm not going to be able to go through each one of these one at a time and tell you what every single one of them does, although that would be a really fun presentation, maybe boring for you to listen to, but I would love to tell you what all of these are, because truthfully, when I talk about all of these, they make me really excited. I think that there are so many amazing health careers out there. Oftentimes people reduce health professions to the big one, right? Medicine, in terms of wanting to be a physician. And they think that when we talk about exploring health careers, we're talking about specialties in medicine, which is true. Like, if you want to be a physician, absolutely, that's a valid goal. And there are lots and lots of careers within the field of medicine, like pulmonary or cardio or working in an ED, so many different things you can do in medicine. However, even outside of medicine, there's so many health professions that there are so many that aren't even listed on here. But these are the big ones that I found myself talking about over the years with students who are in that exploratory phase. And I don't know if anyone has ever had this situation come up where being in that kind of exploratory phase of life is kind of looked at as a negative thing. I don't know if anyone feels bad about being in that phase where you're just kind of figuring out what you want to do and you're not sure. It might seem that way. It might seem that it's bad sometimes when everyone around you is really sure what they want to do and you're sitting here going, I have no idea what I want to do. I just want to, I guess, reassure you that, first of all, it is 100% normal to not know exactly what you're going to do for the rest of your life at any stage in your life. There are people who don't even know what they want to do when they're 30 and they realize they want to go to a specific health profession when they're 30 years old or 35 years old. So if you're, 17 or 18 or 15 and you have no idea what you want to do, please know that that's more than normal, probably healthy for you to be in a state of exploring at this point. So as we get into how are you going to narrow down all of those health professions to maybe 4 or 5 today that you might want to consider? These are the things we're going to explore, and I'm going to kind of focus on these concepts rather than going into all the nitty gritty. Although you're going to hear that I'm going to go off on some tangents about some of these professions that I get excited about. So we want to think about when we're choosing a career, we really want to focus first on what is it that I can do well. Because truthfully, when you go into a job, you want to do the job well, right? Like you don't want to go into a career that's like squeezing a square peg into a round hole and your entire life you don't feel like you're doing a good job. If you are not naturally inclined towards certain skills, and then that's what your job requires, you're gonna have a whole life of like mediocrity, like always getting mediocre reviews at work because you're just not that good at it, right? So what we'd rather do is think about, what am I really good at? What do I excel at? What do I love to do? Usually the things we love to do, we also are somewhat good at them. And then we're going to start to narrow down some positions based on that. Also, the duration and the type of education that you're going to need for some of these careers varies, and that matters to some people for different reasons. And so that might be something that you consider. I don't think that should be the only factor, obviously, because 2 versus 4 years in the larger scheme of things in life is not a big deal. If you get a 2-year degree versus a 4-year degree, um, when you're 50 or 60 years old is not going to make any difference. 2 years is a blink of an eye these days. But in terms of how that process works, almost all of these careers are going to require a college degree. So you're going to go to 4 years of college and then either a 2-year master program or a 4-year doctoral program. And then beyond that, many of these professions have what's called residency, where you go to an additional training of either 3 to 4 years, and then even fellowships, which is an additional training after that. So for some of the doctoral level professions, it's not just a simple like go to school and you get to be a whatever you want. Many of these require years and years and years of training before you can finally say, okay, I'm a licensed, subspecialist in a certain field. For some of you, if you've had either a really stressful life and you're thinking, okay, I really just want to have some peace in my life. I really want to have a work-life balance. I'd like to have a family. I want to go home at night. Work-life balance might matter a lot to you. Or if you've had parents who were home with you and ate dinners together, you might be thinking, that's what I want for my own family. So we'll talk about that also because it does matter. Different professions obviously have different work-life balances. I don't tend to get too in terms of the next one, income. You can look up the income for various health professions. You're going to make a decent living with any of the health professions. I don't think that income is what should necessarily drive you towards a career. So one quick story, when I worked as the director of admissions at a medical school, my boss was a neuroradiologist. So that is like the most subspecialized you can get. I know this woman made a lot of money, like probably at least $500,000. Like she made a lot of money. However, she was 50 years old and still worked night shifts, still worked every holiday, still, had no control over her schedule. She would complain all the time about how, she had to work, X number of days in a row, overnight, on the weekends. And I'm sitting here thinking, okay, at age 50, I don't want to work on the weekends. I don't want to work at overnight. I go to bed at 9 o'clock. There is no amount of money. You can keep your $500,000. I don't care if I'm rich. I would rather go home and be with my kids or go to bed at 9 o'clock. That is just what I prefer in life. So, different people have different values, and I'm sure she loves her job as well, and it didn't maybe feel like work. But for me, I like my job and I don't have to work overnight. So, different people have different values, and you've got to consider what matters to you. Like, what is your life going to look like if you do it this way? Income and demand honestly varies drastically by geographic region. So if you're in a very saturated region for a specific health profession, then it's going to be harder to find a job. It's going to be less pay. But if you go a little bit further out of your region where you're going to see a higher need for different health professionals, and it doesn't take too much of a Google search to find out what those regions are. You'll be in more demand. So that's always that's one way to think about a job in terms of how in demand it is. It's not that it's universally across the country the same. It's going to vary by location. And then your work location. Sometimes, like I said, you can envision yourself in a busy hospital with beeping and noises and smells and all the commotion that might really excite you. And you're like, that's where I see myself. Versus working in a small, controlled practice where it's a little bit quieter, cleaner, and calmer. And you might like, personally, like that might be better for you if that's how your brain operates, if you prefer that type of environment. Some people just know, I want to be a surgeon. I don't know what I do, I just want to cut people and poke people and see all the stuff. I want to look in people's bodies, I want to build things in the body, I want to fix things, I want to work with my hands. So if that's what you're thinking, we're going to talk about that as well, because I know that is a thing for a lot of people. And then some people know they want to work with specific populations. They say, I want to work in women's health, or I want to work with children, or I want to work with marginalized communities or underserved communities. I have people who want to work with geriatric populations. They really like older people, and they want to do anything related to that. And then the last thing I'll kind of talk about is duration of patient visits. And by that I mean how much time you actually get to spend with patients. And that varies also a lot by profession. And not only duration, but just the quality of that experience. So for example, I always think about my experience with a dentist. Whenever my pre-dental students talk about like talking with patients, I'm like, when I'm at a dentist, I never get to talk. They talk at me, but I'm laying there with my mouth open. I'm not having a full-fledged conversation with my dentist. So it's kind of funny because like I always think about the conversation or the relationship building. Now I love my dentist, but it's not the same kind of conversation. It really is one-sided, and it requires my dentist to be kind of funny, right? And kind of entertaining in a way, because while I'm laying there and I can't talk, he has to entertain me. He keeps the conversation going, and all I can do is grunt or giggle or whatever, but it's not a full-fledged conversation. So that's a skill set, right? Is to get someone to like you even when you can't have a whole chit-chatty moment. And there are lots of different professions where you're going to spend a lot of time with your patients, whether it's occupational therapy or physical therapy, where you're going to get lots of time to talk, versus something where the average encounter is 15 minutes, like a physician assistant or a nurse, where you're kind of bouncing in and out throughout the night and you're not sitting there spending long periods of time talking. So those are some of the big things we're going to talk about as it relates to these different professions. And I'm going to break some of these down, and then we're going to explore some of the professions that fall under some of these categories. And again, if anyone has any questions about anything I'm saying, please don't hesitate to post in the chat or Q&A box, and Mandy can definitely ask out loud for you so that I can make sure I'm addressing anything that comes up. So when we talked about skills, here are some of the skills that when I was thinking about all the students that I've worked with over the years and all the professions that I've advised for, these are the skills that are probably the most, I would think, relevant in terms of health professions. And then I think the first one was a little outside the box even for me to write. But when I was looking at the professions, I was thinking about this ability to think and this ability to focus on things. We've been having a lot of conversations. I've been having a lot of conversations with students lately about the idea of mindfulness, and I don't know if that's something you've ever heard of, but this idea of being mindful with your patients, being present with them, being really focused on what's going on and what they're saying, and really like honing in on the like the dynamic, the human dynamic, in terms of how someone is behaving and how someone is responding to you. And I say that because it's so important in healthcare when you have patients who are nervous or fearful or hesitant to share information, or might even be experiencing mental illness. And if you're not hyper aware of other people and just what that dynamic looks like, and being able to focus on people for an extended period of time, I think a lot can get lost in that moment. And so I added that because some of these professions where you're going to be helping people really does require that you focus, right? That you can really like zone in and pay attention. With the use of technology these days, they say that the ability for someone to stay focused for more than just a few minutes is actually diminished quite a bit. And our brains are so hyper because we're so used to scrolling. Like, think about when you scroll through those reels and you're like looking at one thing after another, like you're scrolling within seconds, right? You look, you're bored, you scroll, you scroll, you scroll. And in medicine and healthcare and all these professions, it's not like that. You're forced to just be in the moment and focus. Manual dexterity is the ability to work with your hands. And so many professions really require you to be, I guess the opposite would be not clumsy with your hands. So if you're someone where you tend to drop things a lot, you're fumbling a lot, like maybe if this is you, like you might be thinking, oh, my family always teases me about this. I'm not really good with my hands. My hands are big and clunky, and I don't like to do like really intimate detailed, like small things with my hands, like sewing. If sewing with your needle is out of the picture for you, then there are a lot of professions where manual dexterity is actually really required, like dentistry is one of those. You actually have to demonstrate manual dexterity in your application if you want to go to dental school, because think about what you're doing. You're in someone's mouth with your hands doing very small work. Your teeth are tiny, right? So you really have to be able to maneuver with very little instruments around very small spaces. And so not only do you have to have really good eyesight, but you need to have that manual dexterity, and along with a few other professions. Conversational skills. I've met some teenagers who, and I'm sure they're going to grow out of it, who really don't want to have conversations with people. They don't like to chit chat. They can't just, strike up a random conversation with an older person or a stranger and just keep it going. And I want you to think about what is expected of when you go into, like, if you've ever gone to a health profession appointment, maybe you are the type of person who'd rather just sit in silence and just answer questions, but the majority of older people really like to talk. You've probably noticed that, right? They really like to talk, and they really like people who talk back with them. And so this ability to just be chatty and be able to have a conversation with anybody at any time about anything, that's an actual skill. So you can think about it like politics, right? Like politicians are really good at just schmoozing and chatting. If you're good at that, you're going to be great in the health professions, because that's a lot of what this is building that relationship, building that rapport with people. Also, some professions are leaders, and you're going to actually be speaking in front of groups, especially as you're training and your lifelong training. You're going to be going to conferences and presenting. In a lot of the professions, you're a leader, and so you'll have a lot of time to develop your leadership skills. But if that's something you're thinking, well, I don't want to be in charge of anything, I really just want to show up and do the work, there are certain professions you probably wouldn't want to enter then, because you would be the leader of the space. So, for example, if you're working as a pharmacist, you're in charge. Like, all the farm techs working for you, they are going to be looking at you and making sure that you know what you're doing. Optometry, physical therapy, if you are the doctor in the space, you are the one in charge, and you've got to be motivating and inspiring to other people. Demonstrating patience is just something you have to have if you're going to go into a health profession, because there's going to be difficult people, there's going to be challenges, there's going to be lots of processes that aren't going to work, technology is going to fail, and you just have to be very, very patient. And then teaching other people. Hopefully some of you have had a chance to like tutor or work with even just your friends teaching things. You can start to see, am I someone who can explain concepts to other people? Can I teach people things? A lot of what you're going to do in a health profession is going to be creating a treatment option or a treatment plan for people and explaining how it's going to work in their body and why this treatment plan is the best route for them. And a lot of times you're going to be convincing people to adhere to their treatment plan. And so being able to speak and explain something that's a little bit complicated, because a lot of people don't have a science background. So you have to translate that science into way that anyone can understand, right? And then cultural competence, I actually prefer cultural humility, where you are still learning about people different from yourself, but especially being comfortable working with people different from yourself is again, like, it's not just preferred, it's actually a requirement. You have to work with people different from yourself, and you have to be kind. You have to be competent at not showing bias and not being discriminatory and just being, not a nice person. So that's a requirement. You have to be okay working with difference, and hopefully even enjoy it and want to do it. Technological skills, you are not going to go into any profession, honestly, with avoiding technological skills. I don't think that's probably going to be a problem for most of you. But if you're, for any reason, technologically adverse, then I would say some of the professions you're going to have a hard time with, because many health professions now, really utilize most technology. Okay, so those are the big skills that we're going to think about. And so as you're thinking about what you have or what you're good at, um, I want you just to kind of be taking some notes, some inventory in terms of, like, what do I think I'm the best at of these? Like, what do I see myself doing well? Now, if you're thinking, I am awful at demonstrating patience. Whenever my little sibling comes in, I scream at them, I tell them to get out. I get really short-tempered with my mom. Whatever it is, if you are not the best at demonstrating patience, I just want to assure you that that doesn't mean, you're a lost cause and you probably should never consider a health profession. What that means is that if you're aware of that, you have plenty of time to build on that skill. And so I should have put on here the ability to self-assess and the ability to grow and change and adapt. And hopefully that's something that you all recognize. If there's a weakness that you have lots and lots of time to grow and to work on that before it's time to commit to a profession. But sometimes we just know about ourselves. Like, I just know that I never want to work with my hands. I like to think, I like to write, um, I like to talk to people, but I don't want to do any procedures necessarily. And so for that, actually, I don't want to get ahead of myself. Let's see what I have going on here. So we're going to kind of just break down some of these different things that I just talked about, and I split up the health professions by these different categories. So, and I have a couple I want to highlight in each one and kind of talk about why that's relevant. So I mentioned the duration of your training. And a master's degree is usually 1 to 2 years. Most of the time it's 2 years. It could even be 3 years in some cases. But a master's degree for a lot of health professions is enough to get you into a career. Most health professions are not going to get you into a licensed position as with just a bachelor's degree, with the exception of two. So a clinical lab scientist and a registered dietitian, you can become a registered dietitian with a master's degree, but a lot of programs at the undergraduate level actually prepare you. They have nutrition programs at the undergraduate level that will prepare you to get an internship as an RD and be able to practice as a registered dietitian without having a master's degree. But you have to go to an undergraduate university that has that program, and so you can begin to prepare for that. The same thing with speech language pathology. You can actually go to an undergraduate school, get a major in speech language pathology, and then graduate and be able to practice. However, if you happen to not realize that you want to be a speech language pathologist while you're an undergrad, um, then you would go and do a master's degree in speech language pathology and be able to get, it's an entry level program, and be able to get your license to be able to practice. The one I actually want to highlight, though, from the master's degree list is one of my favorite professions, and that's genetic counseling. When I first went to UC Davis, or in California, I had no idea what a genetic counselor was. I literally just, I would have had no clue how to describe that to you. I never had genetic counseling. And then I got to spend a lot of time with genetic counselors. I got to talk to them. I heard a lot of them speak. They came into campus and talked, and I was floored. I had no idea. So this is what I learned from the genetic counselors that I heard from. I always assumed that when someone went to the doctor and they had genetic testing done, I always assumed that the doctors got the genetic tests and the doctors would read the test results and the doctors would tell the patient what was wrong with them and what the next treatment plan was. That was my assumption. I thought, well, they have a doctorate. They should do that, right? I found out that there are all these people who work behind the scenes who do the actual, like, I guess, manual labor, aka thinking about it, the analysis. And the genetic counselors are the experts on all genetic diseases and disorders. They are the expert on genetics. So genetic counselors in their 2-year degree are trained to know how to read all genetic tests. They're trained to know all the diseases. And not only that, but they are trained to know what the best treatment option would be for various the testing outcomes. So if they look at your genetic test, they will tell the doctor, this is the treatment plan that you should follow. And it's all in a book, and they know it all. They're the ones who learn it, and they're the ones who tell the doctor what the treatment is. Again, when I found out that the genetic counselors are the ones educating the patients and the ones that are telling the doctor what to do, I was so shocked. Um, and I heard this over and over from different professionals who were doing this. You could specialize in all kinds. Like I met genetic counselors who specialized in oncology. So all they did was study cancer, and they talked to patients who had cancer based on their genetics, and they worked with oncologists, and it was just absolutely fascinating. And so that's kind of like my highlight for the level of education, because with a master's degree, with just 2 years, you are essentially diagnosing and understanding what the treatment option is for patients. That's almost exactly like what a doctor does. Um, and in this case, you are literally informing the doctor. You are going to know more about this than any physician would, unless the physician, studied, was a geneticist. So if you are looking for a career where you get to diagnose, that would be a really good option if you don't want to go to a 4-year institution. You want to get in and out and get to it. Now, genetic counseling is actually very competitive. It's very hard to become a genetic counselor. Don't let that stop you. But I'm telling you that because clearly a lot of really smart people have realized that this is a really awesome career, and that means the applicant pool is up, which means that it's very hard to get into. So you can do some research about that. If you're thinking, I like talking to people, I like explaining difficult concepts, I like thinking really hard about problems, I like investigating things, and I like to, again, like present an option to patients, and patients might say, no, I don't want to have an elective procedure done to prevent this. So then you talk to the patients about timelines. Well, if you don't have the elective procedure done now, maybe you do it by the time you're age 30, or you do this or this instead. And so there's lots of problem solving and thinking involved in that. So on the other side, I have a doctoral list. So these are all programs that require not require, but some of them require and some of them don't require. So the one I highlighted is the one I want to point out. Occupational therapy, another amazing career. You can actually get a master's degree or a doctoral degree in it. And so if you got a doctorate in OT, um, what an occupational therapist does, and this is where I always sent people to OT if they said things like, well, I want to spend a lot of time with my patients, and I want to make a difference in the patients' lives, and I want to help them live better lives. When people said things like that, I was like, OT flag, like bells and whistles going off in my head. So, whenever someone is diagnosed with a disability, and it could be a physical disability, it could be a mental health disability, it can be something like autism, or something like um, being deaf or being blind, it could be so many things. It could be a veteran who just came home from a war and is missing an amputee, missing a limb. Um, but what an occupational therapist does is help that person learn how to live a normal life. And by normal, I mean a actually, that's not the right way of putting it. I'm not saying it right. They help them find adaptations to their current life so that they can live the same life that they had before, but with adaptations. So, for example, an occupational therapist would go into a home with an amputee and help that person learn how to navigate their current home with adaptations and accommodations so that they can live the most normal life they could, right? In the way that they had before. That's what I mean by normal, is their life that they had before their disability. And so they teach them how to do laundry without an arm, or they might teach someone who just became blind how to read Braille, or how to, they might help a child with autism how to navigate the world socially. But there's so many different kinds of disabilities that people can specialize in. So one time I was able to go out to San Antonio and visit the rehabilitation center for the U.S. Army. And this center was, gigantic building, 4 or 5 stories of nothing but occupational therapy or other kinds of therapy. And I'll give you a couple of examples. I walked into this room and there was this giant screen. The whole wall was a screen. And there was a giant treadmill on the floor, and there was a man on the treadmill, and he had his shirt off, and he had a bunch of what am I trying to say? They had a bunch of monitors all over his chest, and there was a person who was an occupational therapist sitting behind him at a computer screen. And the man was walking, and on the screen in front of him looked like a neighborhood. It looked like a very realistic neighborhood, and he was just walking through the neighborhood on the treadmill. And what was happening was the man had PTSD. And so the person, the OT was trying to condition him how to respond to triggers that might affect him post-war. So as he was walking, things would happen, like someone would drop their trash can really loud, and so he was monitoring the man's heart rate to see like when things triggered him. And as things triggered him, then he was teaching him how to cope with that. He was teaching him sort of like cognitive behavioral therapy of how to handle those thoughts and how to calm down as he was going through that. In the same building, they had adaptive cars, so people were learning to drive. People were learning to play basketball. People were learning to do laundry. People were learning to cook. So there were so many ways that people were getting back on track after their disability so that they could be self-reliant and live happy, healthy lives in the way that they wanted to. And when I left that facility that day, I was convinced that occupational therapy was the best career on earth, because you have someone who just experienced such a trauma, and this person got to spend hours with them helping them get back on track. And it was just amazing. It was so inspiring to watch. And so I always think of that when people say that they want to help people, like really help people. That's helping people, because you can't, like, everybody wants to have a life, right? The life that they want. And when something like a disability gets in the way, occupational therapists make it possible again. So manual dexterity, the ability to work with hands. And so clearly, in almost all settings, you're going to have to use your hands. Yes, you're going to type and you're going to do other things. But, I was thinking of careers where you use your hands a lot. And so dentistry, like I said, is probably the most talked about career when it comes to manual dexterity. I put podiatrist as number 2 because in the mouth it's really tiny, but in the foot it's also really tiny. You have like, I think it was like 26 bones or something, like a lot of bones in your foot, and they're so little. And when you're doing surgery on feet, you've got to have, a lot of manual dexterity to get in there and use those tools. I highlighted clinical lab sciences because it's a lab-based career, and you are basically processing specimens. So similar to how the genetic counselor does the work of finding out what's wrong with the patients for genetic diseases, the clinical lab scientist does the same thing for the pathologist. So in medicine, there's a pathologist who will, basically be responsible for the labs, and they'll explain, what the diagnosis is based on the lab results. But the clinical lab scientist is the one behind the scenes doing the work. So they are the ones in the lab running the specimens, figuring out what's wrong with the patient, and then delivering that information to the hospital. So if you're thinking, I want to be in healthcare. I want to help solve problems. I want to help treat patients, but I don't really like people. I don't really want to work with people. I just want to work with medicine. I want to work around healthcare. I want to work, in a lab. This is a career where the only people you're going to work with are your friends in your lab, right? Your colleagues. You're not going to have any patient interaction. And I think for a lot of people, they think all healthcare careers are patient centered, but not all health careers force you to be with people. So I wanted to highlight that one because most people don't think about it as a health career because you're not, out on the floor with patients, but you very much are diagnosing and solving problems and working with your hands, with machines. And so that one does not require a master's degree. That program for a lot of schools is fully funded. So you get your bachelor's degree and then you go do a year-long training program that's fully funded. And then after that, you get a job right out of your certification program as a CLS. And then from there, you can specialize and continue, building on your career. This is like I said, a great career for people who want to do science but don't necessarily want to go into a patient-centered focus. Not so much in terms of hands-on. I have a clinical psychologist, which is going to be a lot of talking and thinking. I wanted to highlight a naturopathic physician though, because again, this is one of those careers where when people think about medicine, they tend to think about allopathic and osteopathic, but naturopathic medicine is you in most states you're billed as a primary care physician. And if you think about a lot of people in America, a lot of people are very resistant to Western medicine in the sense that they're very resistant to medication. Most people don't want to have intrusive procedures done, and if they can avoid taking medicine, they will. And so, what a naturopathic physician does is first look for alternative ways to heal aside from going straight to the most intrusive or pharmacological approach. So, what does that look like? It could look like addressing someone's health through the food they're eating, food as medicine, or the degree of exercise. It could be looking at managing stress levels, so managing mental health through what they're eating, how they're exercising, how they are um, managing their stress. Now, there are definitely some mental health issues that need to be medicated, and a naturopathic physician has the ability to write prescriptions, and so they're trained to know the difference between when something can be treated with a natural approach and when something has to be treated with um, pharmacology or a more advanced procedure. And when something needs to be treated with a procedure, then they would refer that person to a different type of physician. But for people who just have who are going to the doctor to see for a cold or for weight loss or managing diabetes or something like that, a lot of people can go to a naturopathic physician and get a lot of care actually that makes them less reliant on medicine. And so I would argue in America right now, that's actually a pretty hot, like high demand place to be because we can see that there's a great mistrust of Western medicine in a lot of communities. And so there's a lot of potential to market yourself, if you market yourself in the right way with the right people, to be very successful in that career. Um, the other ones, public health, speech language, genetic counseling, you can kind of see how those are a lot more conversational based or educational based careers, not so much doing procedures. For me, working in a hospital is probably one of the biggest, like the biggest way to start to separate out careers. And so if you are thinking that you absolutely don't want to work in a hospital, right off the bat, we're going to be able to rule out several things. Um, some of these, it goes both ways. So for example, like a podiatrist, if you're going to do surgery, you're going to work in a hospital, but you don't have to do surgery. You don't have to work in a hospital. You could work in a private practice and never do surgery. You're not going to make as much money. But if you want to, if you know you want to be a surgeon, which most people do, if they go into the career, they are definitely going to work in a hospital. The one I highlighted, registered dietitian, I highlighted that because I think when people think of dietitian, they often think of like weight loss, that that's what a dietitian does. When in fact, one of my best friends was an RD, a registered dietitian, and I don't know why I'm always drawn to, oh, a lot of my friends are health professionals for some reason. But she always talked about her work with me, and what she described had nothing to do with weight loss. So what she did was, she worked in a burn unit, and the patients had very specific diets that they needed to be on because they had certain nutritional needs, but some of them couldn't eat food, couldn't eat whole food. And so what a dietitian in the hospital does is they're responsible for all of the patients' meals. They're responsible for making sure that the patients are getting the right combination of nutrients and the right food based on their unique dietary needs, based on their disease, based on what's going on. And so the dietitian approves of all the meals for the patients and makes sure that they're getting everything they need. So they oversee the food process, not necessarily making the food, but just making sure that the diet is appropriate for the patients and that's not interfering with any of the medicine that the patients are on. So that's what a hospital dietitian would do. Now, if you wanted to focus on weight loss as a dietitian, you certainly could. And it would be more based on nutrition, not necessarily weight loss. But there are people who would seek a dietitian for something like weight loss, but it would more than likely be more clinical in nature. So, for example, if someone was pre-diabetic and they wanted to, again, like address food as medicine and thinking about how can I manage my diet in a way that manages my labs, a dietitian could have a conversation with them about food options that are culturally appropriate that would help them manage different aspects of their condition. So what is not as common in a hospital, you can see everything listed here. It's not that these things don't end up in hospitals. Like, for example, physical therapy is absolutely in a hospital, but you can also be a physical therapist in a clinic or a practice, and you don't have to be in a hospital. Same thing for occupational therapy. I actually met my first occupational therapist in a hospital, so that's possible. But what a lot of OTs do also is go out into the field and work with people in their homes. But I highlighted a clinical psychologist, and this is a little bit selfish on my part to kind of boost this one. There is such a need right now in America for psychologists, people who work with mental health, especially with adolescents and children. And it's right now about to boom more than ever. If anyone's ever tried to find a therapist, you know how hard it is to find someone. And if you can find someone, whether if they'll take your insurance, that's even harder. A lot of them do cash only. It's just incredibly difficult right now. And there's such a shortage because it's just not a field that a lot of people think of when it comes to health professions. People want to be doctors and dentists. Most people don't think about wanting to be a therapist. But we know in America how prevalent mental health and mental illness is. We know how important mental health is and how prevalent different mental illnesses are. And having psychologists in the schools, having psychologists in the community, having culturally appropriate psychologists, having psychologists focused on LGBTQ health, having psychologists focused on certain cultural backgrounds, bilingual psychologists, like so many ways. In so many ways do we need to increase the diversity of this profession so that more communities, especially communities where there's stigma in healthcare, a stigma around mental health, these need to be addressed. And so if you like talking to people, if you like listening, if you like problem solving, if you have always been someone that people trust and they talk to you about their problems, like that might be something that you consider as a profession. It's going to be a clean profession. You're not going to be standing on your feet for 12 hours. You're not going to see blood. You're not going to see needles. You're not going to be, cleaning up messes with vomit, nothing like that. It's going to be very, I don't want to say comfortable. Mental health is not a comfortable conversation, but it's not going to be the type of healthcare profession that you think of normally when you think of like working in a hospital. So for some of you, that might sound very appealing, right? You might say, I know I want to help people. I want to address needs, but I don't know if I want to stand in a hospital all day. And that's fair. And so this is another option for you. A lot of people though want to be surgeons, so they want that. They want all of the components that go with surgery. The number one field, I would say, besides veterinary medicine, I don't know if anyone is interested in that, but the number one way you're going to be a surgeon on at least of the list that I provided is through being a podiatrist. Every podiatric medical student is trained to be a surgeon. It's part of the education, and then you're going to be doing surgery when you're in your residency. Again, it's not something you opt into in residency. You are absolutely going to be seeing surgery in surgeries. It's part of the training. And then whether you actually practice surgery in your future, that's totally up to you, but you will be trained as one. And so that gives you that option. And what kind of surgeries would you do as a podiatrist? Lots of trauma happen in the feet, whether you break, you drop something on your foot and crush your foot. Sometimes people need amputations, unfortunately. A lot of diabetics have podiatrists on their care team. When diabetic patients end up needing to have amputations in their lower extremities, it's usually the podiatrist who does that. Sometimes feet need to be rebuilt if you have a huge bunion or some other deformity, and the podiatrist would go in there and open everything up and reconstruct the foot. And so again, very small space, lots of manual dexterity needed there. And then on the other side, we have not so much, right? Like we're not really going to be doing any type of, I can't think of anything here with any of these that we are really going to have anything near surgery. Chiropractic medicine is I highlighted because like surgery, which oftentimes is intended to get rid of a pain or get rid of an ailment, chiropractic medicine does something similar. And I've never been to a chiropractor myself, but what I've always heard people talk about, and I've heard chiropractors come and talk at my school, was the immediate relief of pain. And a lot of people live with pain from various causes, but chronic pain is something like in the neck, in the back, or headaches. Even people do chiropractic on their babies. And so it's like immediate relief without needing to take as much medication. So if you're not wanting to take a lot of pain pills, you can go to a chiropractor once a week and they will, hands-on touch your body, help align things, and get things back in order so that you can live pain-free for a little bit longer without needing any type of other therapeutic. So people love their chiropractor, right? Because you go in pain, you leave feeling good. If you like small community, usually chiropractors, I always picture them in communities. They usually have practices. You're always going to probably have a private practice unless you join another practice. You're going to be sitting there working on a patient. You're going to get to talk a lot. Probably the business that you're going to build in that area is going to be based a lot on relationships. So if you really like building relationships with community members and getting people to come back, that would be an excellent career where you just get to work on them. Same thing with physical therapy. People get prescribed physical therapy and you get to work on them. You get to help improve their condition. But while you're doing that, you're literally getting to talk to them and explain things to them. And so those are awesome, like hands-on careers where you don't have to be in a hospital if you don't want, and you can spend a lot of time. Working with different populations. So I mentioned working with marginalized or underserved communities, but I find a lot of people like the idea of working with kids. So I separated out careers based on working with children, and all of the professions on the left are absolutely professions that you're going to get to be around children if you want to. Most of these you would specialize in pediatrics. So for example, podiatrist, you can focus only on like foot deformities in babies and podopediatrics, working with children, helping them fix their gait, or if there's any type of issue with the foot or gait walking. Um, the one I highlighted, speech language pathology, is almost predominantly with children. This usually starts at a really young age, and it can be something as simple as a child with a speech impediment, but it can also be as complicated as helping a nonverbal child learn to speak, and helping them with that. So there are many ways that a speech language pathologist can help children. It's always going to revolve around speech and language development, and oftentimes the challenges that people face with that are neurological. So there's a lot of science and understanding what causes that, and then there's a lot of science and just linguistics, honestly, understanding how our brains operate and how we speak and how sounds are formed, and teaching children how to speak, how to overcome those obstacles. And so it's very technical. It's a very specialized field. You're going to get trained how to do that. And it's a very high demand. I mean, being born with any of those, like a speech impediment or any type of difference, is going to be, you're not going to control for that. There's always going to be people in our community, always going to be children in our populations that are going to have this need. And almost every school has a speech language pathologist on staff. You don't have to work at a school. You can work in a private clinic or a practice, but it's something that's never going to go away. You're always going to have a need for that. And you're going to make a child feel a lot more confident about themselves after they've worked with you. So, I put not really for the pharmacist. I've never imagined a child going up to a pharmacist on their own, asking any questions. So if you were like, I cannot work with children, like that is the last thing I ever want to do, maybe a pharmacist might be a good option for you, because you probably would never come across one back there in the pharmacy. And pharmacists actually work in both hospital and pharmacy. So it's not that you have to be back in a pharmacy in order to be a pharmacist. There is a career called clinical pharmacy, and a clinical pharmacist usually works in an emergency department. And what they do is they compound medicine on the spot whenever a patient needs any type of medication. So if someone comes in and they need to receive a medication, it's the pharmacist and the ED who mixes the bag of medication that's going to be given to the patient. It's not the nurse, it's not the doctor, it's the pharmacist. And the pharmacist in some states can actually literally connect the patient to the IV, but in most states they can't do that. The nurse has to do that. So they just make the medication, they hand it to the nurse hooks it up. A pharmacist is extremely important when you think about how medications mixing can be so harmful, how dangerous that is when patients are on so many different medications. And imagine if a physician accidentally writes the wrong prescription or writes the wrong dose of a prescription. Physicians are not usually experts on pharmacy. They take a class in medical school on pharmacy, but they're not or pharmacology, but they're not experts on all the drugs. So a pharmacist oftentimes catches the mistakes of the physicians and can, they often reach out and correct the mistake, have the physician correct the mistake before it causes any harm. So the pharmacist is the last check before the medication is given to the patients. They just make sure that whatever was prescribed to the patients is correct. Again, this is one of those things that really shocked me, because you always think about a doctor being like the final say and the one in charge, and that whatever the doctor says goes, but actually the pharmacist has the final say. They often check the work of the doctor, and they often catch mistakes and fix it before anybody is hurt. So if you like that kind of critical thinking and working like in a clinical pharmacy space, working on the spot, and being able to look at a patient, look at how much they weigh, look at how tall they are and who they are, and being able to know exactly what dose they need of which drug, and how that interacts with other drugs, and doing all of that very, very quickly in your head. If you like memorizing things, that might be a really good career for you. So if you are interested in doing research, you can do research in any field. There is literally no limitation when it comes to research. You know, in research, you really need to find a passion and interest in a specific area, whether it's public health research or a wet lab research or some disease that you want to study. But literally in any profession you go into, someone's going to be doing research on issues related to that profession. And so I wouldn't let the idea that you want to do research govern where you end up. If you're thinking, I want to do research so I can only be a doctor, that's really short-sighted. Literally anything will lead you to research. So I'm going to pause there, and I'm going to ask Mandy if anybody has any questions.
We do. We've actually got two great ones. So the
Okay.
first one is a procedural one. Is there a way that you could make these slides available to HPW so that we could make these slides available to our audience tonight? Because there's so much information here that it's just absolutely amazing.
Yeah, absolutely. I will share these with you, and you can post them
Yeah.
wherever you like.
Yeah, we'll get them into the handouts into this session. So this is fantastic. The next one is, Joanne, I need you to look into your crystal ball and tell me what's a great career for somebody who really just likes math, science, and statistics. So this is one of those questions. It's a great question because you've
Okay.
got those passions, right, in those sciences.
Mhm.
How do you start to marry
Yep.
those things?
Okay. So when you say statistics, the first thing that pops in my head is public health. Because in the field of epidemiology, you're going to study the prevalence of disease in different communities and different populations. So if you want to run numbers and figure out like how to solve problems from a big picture analytics point of view, also biostatistics is a field now that a lot of like health professions are kind of joining forces with. So you're looking at problems from a big data analytic point of view, and you're looking for patterns in populations and in geographic locations and just all these different variables, trying to understand how to solve some of our problems in healthcare from a statistics point of view, from an analysis point of view. So my first thing would be like, if you are more drawn to the statistics and analysis aspect of that, look into biostatistics as a career, or bioinformatics, or you can do something like that in public health. If you ended up majoring in college in something like biostats or anything related to stats, you are going to get eaten up by almost any profession, I promise you, because every profession is going to want someone who is a statistician who can do this kind of work. I'm thinking about another career where science and statistics, I don't know why, but my mind is going to genetic counseling, because there are going to be a lot of like, I'm not an expert on this is not going to be phrased correctly, but like the odds of, right? Like if you have these genetic conditions, the odds of you getting this disease are X. And if you have these genetic conditions under this circumstance, the odds of you getting this disease are Y. So I'm not sure exactly how much literal statistic analysis is done, but I know that there is some degree of analysis and genetic counseling. Um, Optometry is going to be a lot more physics than statistics. Yeah, and then honestly, like I said, if you went into any of these fields and then went into research, you're going to use statistics. You have to use statistics in research no matter what you do. So your interest in statistics is probably going to lead you down a path of research, I'm guessing naturally. And so let yourself do that. If that's something that you are naturally drawn towards, don't don't let anyone tell you that that's not the right place for a health profession, or that those two things can't be married. You can literally marry any passion with health profession. If you have an interest in art, you can go into art therapy. If you love music, if you play an instrument, you can go into music therapy. There's so many ways that you can find a career that pairs your love for science and your love for art, or your love for anything. If you want to go, if you love sports, you can go into sports medicine. Podiatry is another field where sports medicine is huge, because every athlete uses their lower extremities. And so if you want to go into sports medicine, you could be a sports psychologist. You can go into podiatric medicine. You could go into physical therapy. You can go into athletic training. Just so much, right? Like, that's why it's so exciting. So many ways that you can use all these different interests of yours. Great questions, though. Are there any fields on here that you still like, I'm not sure what that is, and I don't know if I would want to do that? Anything popping up, Mandy?
No, I was just going to say I'm not seeing anything else in the chat queue yet.
Okay. So with that, the rest of the slides honestly are a lot of descriptions of what some of these professions are, and I'm not going to read a PowerPoint to you. I'm really glad that I'm going to share this PowerPoint with Mandy, and she could send it out to everyone who attended, and you can look it up. But truthfully, if you have that list that I shared with you, you can Google all of this, right? Like, this is not my knowledge. So you can Google these professions. I want to get to the last slide, which is probably the most important slide. So how do you discover what it is that you want to do? There is not a best way. There's not, the worst way, I think, I'm sorry if there are any career counselors here tonight, but probably the worst way is just taking a test and getting some spit out answer based on a score that says you should be whatever. That might account for your skills, but that might not account for your passion, or that might not account for where you want to like physically go to work every day, or what your work-life balance would look like. So it's choosing a career, although we can try to fabricate all of this by putting together our skills and our goals and our this and our that. That's a good way to start to pick things and narrow things down. When you put yourself in situations where you're doing things. So the best way to discover what you want to do is to do things. And it doesn't matter what you do. You just need to get out there and do things. Get out from behind your phone, get out from behind the TV screen, from behind your computer screen. You need to get out on the ground with real life humans and do things. Why? Because you realize very quickly what you're good at, what you're bad at, what you like, what you hate. And when you start to realize these things, you're going to start to gravitate towards what you're good at. You're going to start to do more of things that you enjoy. When you enjoy things, you do them better. When you do things well, you get recognized for it. When people recognize you for the good things you're doing, you get offered opportunities. So even though you might start out by volunteering at an organization in your community, you may volunteer for 2 years and you're so passionate about it that the person loves that about you and offers you a paid job. And then you end up working at the organization for 2 years getting paid. And then this other organization sees how great you're doing and they try to steal you and offer you more money. And so now you're going to have more responsibility and you're going to get to do something different and challenge you. And then someone's going to come along and say, you know what? You're really good at that. Why don't you go get a master's degree in that? And then you go do that. And then someone in your master's degree is going to go, you know what? You're so good at X. Why don't you come over here and do X with me? And that's how life happens. And that is how you get opportunities. And that's how you end up doing the thing that you're going to do. So quick story before we wrap up tonight. And this is why I formed this it's not a theory. It's true. It's 100% true. Can't be wrong. So when I was doing my master's degree in leadership and policy, I was in a class, and our class activity was, this is when I worked at the nursing college. Our class activity was, our professor was interviewing us in front of the whole class, like a job interview, and he was giving us tips on how to interview. And I did my interview with him. And after class, this woman in my class, who I had no idea who she was, she came up to me and she says, "Can I have your resume?" And I was like, Why? Like, for what? And she's like, well, there's a job opening where I work, and I think you would be a really great candidate. And I'm like, what job? And she's like, it's in admissions at the new medical school. And I had worked in admissions before, and I said, oh, no, 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 I'm not doing that. I'm not doing that. I don't want to work in admissions. Oh, okay, okay. And she left. And then the next week she came up to me again and she said, can I please have your resume? You know, I really think that you would be good at this. And I said, what is the job? And she said, it's the director of admissions. Now, I was 28 years old at the time, and so I was thinking, a director of admissions at a medical school. Well, I am clearly not qualified for that, and I'm extremely young, but sure, like, you want my resume, lady? Fine. Here's my resume, and I'm like, there's no way I'm going to get a job as a director of admissions at a medical school, and I don't even want to work in admissions anyway. So of course, it has to happen that I got an interview and I'm thinking, I don't, you know, there's no way. I don't even want this job. I liked my job. I liked what I was doing. But then I got the job. Of course, I got the job because I didn't want the job. So I got the job. And when you're 28 years old and you get a director position and a $25,000 pay increase, you take the job and you say, okay, I'm going to do this job for 5 years, because that's about as long as you should stay at a job when you're 28. So I did it. I stayed 4 because I couldn't stand another minute of not helping students directly. And I went over and I left and I went and I did advising, pre-health advising. Now, moral of the story, I identify as a pre-health advisor. That is my passion. That is what I do. I love helping students reach their goals when it comes to health professions. I would have never gotten where I am right now in terms of my knowledge base had I not taken that job as the director of admissions at a medical school. I learned so much from that job. I would have never gotten that job had I not been in that master's program. I wouldn't have been in that master's program had I not taken the job at the nursing college, where I discovered that I really like helping first-gen low-income disadvantaged students. I liked helping those students, and that's what made me go get the master's degree. So different things in our lives lead us to places that we can't control or predict. But along each step of your journey, what you should always do is do whatever you feel like doing at the moment. So if you have a natural inclination towards a certain activity, go ahead and let yourself do the activity, even if you're not sure how it fits into your overall narrative, even if you're not sure, you know, if it's the right thing to do right now. If you want to do it, it's the right thing to do. And I don't mean like, oh, well, you know, don't go home and tell your mom, well, mom, she said if I want to do it, I should, and I want to watch Netflix all day, so I should. That's not what I mean. I mean, I'm talking about like kind of doing some things outside of the house. But in terms of whether, you know, a career plan, if you have a plan in your head of what it is you're going to do for the rest of your life already, I'm saying let yourself do things as they happen naturally, and opportunities will come your way that you cannot predict or control at this moment. And if you just follow life and always do the best you can and work extremely hard and pursue new experiences and let yourself explore. So right now, if you're just barely starting and you don't know what to do, go put yourself in a hospital situation. Go find go out, reach out to your local hospital and find the volunteer office and ask if you can volunteer in the hospital. Spend some time in the hospital, and then you'll realize whether you like hospitals or not. And if you hate hospitals, now you know, right? Now we can go back to that PowerPoint and we can knock some of those health professions off. Go work with children. You can realize very quickly, I really don't like working with children. Go work with older people. You can say, I really don't like working with the geriatric population. But it's a little bit easier to eliminate large groups and large locations right now, early in your career. And then you can always, I mean, who knows, you might change your mind, right? But it's easier to start to narrow things down by realizing what you like and what you don't like based on your natural inclinations versus like just declaring like, I'm going to be a doctor and I'm going to make like, you know, I'm going to make myself like working in a hospital. That's kind of the backwards way of going about this. So start with who you are, start with what you like, what you're good at, what you enjoy, who you normally gravitate towards, and just kind of follow that path and keep a really open mind about what is possible for yourself, because you have no idea where you're going to end up at this point. I had no idea I was going to be a pre-health advisor when I was in college, and I love my job. I absolutely love my job. I am so happy, and I do pretty well at it. So that's my advice to you, is explore by doing things. Get out. Here's some examples of lots of different things you can do, and then let yourself just experience things as they come along, and don't be afraid to try something that's a little outside the box for you. Like I did that interview. I didn't want to go to that interview. I wanted to tell her no. I wanted to stay where I was happy. I wanted to stay where I was comfortable. But I did it, and it was uncomfortable, but it ended up working out really well for me. So I will wrap up there. Any other questions tonight that I can answer for anybody?
Yes, I do. I've got one last question. I'm going to say we have one last question right now. Now, this is obviously being recorded. And so if you happen to be watching the recorded version of tonight's webinar, there is still an opportunity for you to drop a question into the question chat, and we'll get it, and I will get it to Joanne, and we'll get you an answer. So I'm going to start by saying that. Okay, so Joanne, I have another crystal ball question for you. I'm really interested in both psychology and health. I know there are occupations like clinical psychology, as you explained, but I'm curious to know what other health professions might be able to incorporate both of those. So again, mixing and matching these areas.
So one of the professions that actually requires a lot of psychology in order to enter, there's two actually, genetic counseling and occupational therapy. So for genetic counseling, you got to think about what you're doing. People are gonna have genetic tests done that are gonna tell them if they're prone to a certain disease. Now, nobody really wants to hear that they're prone to cancer, or that they're prone to, or if they're pregnant and their baby might have something going on. And so when a genetic counselor has to tell people what the results of their genetic tests are, they really have to go about it almost, very delicately, right? And they're going to be oftentimes the only person there when they deliver this bad news to this person. And so there is a lot of, they actually train them on that as well. That's why it's called counseling. Because yes, you're teaching them the genetics, but you're also counseling them with how to respond to that when they get that bad news. It's not always bad news, but oftentimes if you go to meet with a genetic counselor, it's usually because they have something to tell you. So there's that. And then occupational therapy also requires a lot of psychology, because a lot of the disabilities that you can, like some of the specialties within OT that you can pursue are based around mental health and mental illness. So for example, you can get occupational therapy for a variety of mental illnesses. And so you would need to know a lot of the psychiatric disorders and a lot of psychology in terms of just motivating people and sort of what affects people's psychology, their cognitive abilities. So those are two that come to my mind. But honestly, like, humans are so dynamic. A lot of these professions, you're going to want to have some foundation in psychology and counseling, but those two are probably the most prevalent.
Yeah. Okay, I'm just like, I am blown away by this presentation. And I just, on behalf of everybody in the audience and everybody watching, I just want to say thank you for spending this time with us tonight, because this was amazing. And I think there's so much information here that everybody who's in the audience and everybody who's watching, like you just have a roadmap now for where you can start your research. And so all of this, talking about pathways and finding the right fit, this was brilliant. And I thank you. Thank you so much for spending tonight with us.
You're very welcome. It was a lot of fun. Thanks for having me.
Anytime. You are absolutely welcome back anytime. All right, everybody, you have your marching orders. You know what you need to do. You need to take all of this information and you need to start planning out your path and answering some of the questions that Joanne led you down the path tonight with. If you ever have any questions, please don't hesitate to reach out to Health Professions Week. We have events going on quite literally just about every single day this month. So don't hesitate to jump in. If there is an occupation, a profession, or a career path that you are still interested in exploring, we have another like 28 days left of all of these different occupations and career paths that you can follow. So we'll see everybody tomorrow when we have another webinar from Dr. Tina Tong, Libby, who is going to talk with us a little bit about her career in public health. All right. Good night, everybody.